President Cyril Ramaphosa has announced that the vaccination net is widening, with South Africans aged 18 years and older also eligible to get their jabs. Over 6 million vaccines have been administered nationally so far, while there are some positive news. Over 45,000 vaccines were lost, though, in last week's looting in KwaZulu-Natal and here in the Gauteng province. Let's talk now progress with the Acting Minister of Health, Mmamoloko Kubayi. Minister, good morning to you. You can't be on video because you tell us that you are up and about working. Minister, it's always important to acknowledge positive news when we come across. It is positive news, Minister, that we are seeing the vaccination rollout being ramped up. As we speak, I just had my jab last week, having announced that the window for those who are 35 years and older are going to be vaccinated. So thank you for that. And you also now have just announced the 18-year-olds. What is it that has changed? What is it that you are doing differently from Minister Mkhize, who's on special leave right now?
Good morning, Xoli. Good morning to your viewers. Yes, indeed, apologies, I can't be on video. I'm on the road. I think one always avoids comparison. What you do when you get to the portfolio, you look at best ways to enhance what your colleague has been doing. So that's what we have done. We've looked at what has been the basis, the foundation that has been laid. Enhance on that, looked at the problems where it was not making us move faster, resolve them, and that's why we are here. There were a couple of things that we'd receive as feedback since I got meeting with the Business for South Africa to identify what has been their issues, what they have been raising, and looked at partnering and enhancing our working together. Got the team to give feedback and also look at what the IMC has been raising and what they would want to see. So it's a collaborative effort. It's a teamwork by the department officials, by the IMC Interministerial Committee on Vaccine, but also by partners that we've been working together who continue to give us feedback. So yes, indeed, we've made this milestone. We continue, and we do believe that we'll be able to surpass even the President's target of 300,000 per day. Based on the work that we have done, we are rolling out mass vaccination sites from the 1st of August, which will be a massive support for vaccination, because quite a number of sites are starting to say they are getting full. So we're needing in the congested areas more in terms of vaccination sites. In the rural areas, we are doing targeted mobilization. We've allowed now, because previously you would not do a walk-in. So we've allowed coordinated walk-in. So you would have had to wait for your SMS to come in before you go to vaccinate. Now that has been sorted because we realize that it's not working. The nature of South Africa and who we are as people, because of our conditions of work, because of our condition of our studies, we believe that as we looked into the system, that it's not going to give us the numbers that we want, and that's what we have been able to do.
Yeah, Minister, just to conclude on this issue of the vaccination rollout, the target for government towards the end of this year was that at least, I think, 67% of the population would need to be vaccinated in order for us to get what the President kept referring to as population immunity. Do you think that we are on track to meet that target? I know that it was reversed by the minister, the person who's on special leave right now, but what are your thoughts? Do you think we might meet that target?
Yes, we'll definitely meet. Depending on our supply, actually we can meet it earlier. So if we have enough supply in terms of vaccination, we could be able to get quite a number of vaccination. If you look at the rate now, if we go 250, we're likely to be at 250 per day. We're likely to be around, we can conservatively say weekly we can do 1 million. But we do believe that we can do more. So that's why I'm talking about enhanced in terms of vaccination sites and quite a lot of work. We will deal in detail, because we've looked at CSIR, which is doing what we call projections on the basis of the numbers. For example, they will tell us if we are using Johnson & Johnson, we would be able to meet that by December in terms of about 100 per day, 100,000 per day. If we're using double dose, then we'll have to do about 200,000 per day. So we're targeting at least 400 now, beyond what President has set as a target for us. And we do believe that will bring it forth. Our target is to say, let's try and reach population immunity before we get to the fourth wave. And that's what we are looking at. Projections are giving us end of November to beginning of December for the fourth wave. So to be safe is that at least mid-November we should be able to have vaccinated the population that we want. All
right. Let's talk corruption then, Minister. We know that the President right now sits with a finalized SIU report. I'm not going to ask you to tell me whether or not your colleague still has his job, but I will ask you this. Are there going to be any casualties from what you know, specifically in the Department of Health?
No, in the department, I can confirm that the Director General has received a report from SIU, and that report does have the names of officials that needs to be taken through DC. So that process will be overseen as.
How many officials are we talking about?
I can't have it on my head, Cody, but I think there are 4, if I'm not mistaken.
Okay. 4 officials that are going to go through a disciplinary process.
I can verify the number, yes, but I think it's around 4. I can check the numbers in the report. I wasn't expecting that we'll deal with this, but yes, they are going to go through the DC, and that will be overseen by, as per PFMA and as per the law, it will be the Director General that runs with it.
Is he himself safe? The Director General?
The Director General, yes, he is safe. He's not involved. He's not cited. In the report, there are no charges against him that should be taken through.
All right. Minister, then let's talk about a study that has come out, and I must be clear that this study, which was conducted by a team of New York University researchers, it has not been peer-reviewed. But let me tell you what they have found, and this is specific to the Johnson & Johnson vaccine, which is in circulation in our country. They found that the one-shot Johnson & Johnson vaccine is far less, I should say, correction there, the J&J vaccine far less effective at preventing coronavirus infections from the Delta variant and other mutated forms of the virus. Do you know about this particular study? As I've said, it's not been peer-reviewed yet, but that would be worrying because the Delta variant is what is prominent in the country right now.
Yeah, we have seen that report. I've asked for comments from the team, specifically because they are not even yet peer-reviewed. What we are finding with vaccines, and especially when dealing with COVID-19, is that most of the time you do find people doing some research and then later they withdraw. You have seen the report, the study that was done on ivermectin, which was withdrawn as well. So it's part of what we do. Research continues, updated information. Like we've done, if we do find that J&J is not safe, we'll do the same thing that we did with AstraZeneca. But for now, from the MEC, in terms of advisory, because when I saw it, I asked Professor Ship to just give me an indication, is it something that we should be worried about? And he said, no, there isn't a need to worry about in terms of where they are seeing and the reports, because there was another report, I think it was done by J&J itself, in terms of study where they said it continues to be safe. So we'll continue to look at the research, the reports. Every time they come, I refer that to the advisory committee on vaccine, on vaccine, so that they can be able to look at it, utilize our own studies and be able to test. You remember last time we had a media briefing, we also had Professor Tulio, who also presented the variant in terms of that, and then we had a representative that spoke about the vaccine efficiency against the variant, sorry. So that's what we always do consistently when there's a new variant that we have in our country. We go and look at the vaccines that we are rolling out, whether they're efficacy levels, and whether we should continue to operate with them.
Yeah, Minister, let me ask you to just pause for a moment there. We're going to take a short breather. I do want to continue this conversation around the J&J vaccine because that's the vaccine that my understanding, and you'll correct me if I'm wrong, that you're probably going to be relying on as far as the rural populations are concerned. That conversation in a bit. Very good morning to you. If you're just joining us, we are in conversation with the Acting Minister of Health, Mmamoloko Kubayi. Minister, thanks indeed for continuing this conversation with us. Let me pick up on the Johnson & Johnson vaccine then, with the concerns that we've just highlighted with the study that's yet to be peer-reviewed, but suggesting that it may be less effective against the Delta variant. Is that the same vaccine, Minister, you are rolling out in rural parts of the country because it's a single-shot jab, and in terms of the storage facilities, it's not as stringent in terms of requirements of refrigeration?
Yeah, actually, we continue to use both Johnson & Johnson and Pfizer. Every time we did not have availability of J&J, we utilize Pfizer even in terms of the other communities. So it's a mixture of it. We do prefer J&J in most rural areas because it will be easier for us to roll it out. The single dose is easier because you catch them once and then you do. It should have been our preference to vaccinate the senior citizens with J&J. That's what we get because it's easier to vaccinate them once, and then you get them, you don't have to have them coming back.
Let me interrupt you there.
Population to come back. Yeah.
Let me interrupt you there, Minister, because the J&J jab was the same jab that was used on teachers, right? Now, these people, do you foresee, with the study that's just come out now, to say this jab may be less effective against the Delta variant, do you foresee that the teachers and those people that have used it may need to go for booster jabs?
Okay, Tony, I think we would arrange for a specialist to be able to do this interview with you in more detail because I don't want to claim to be a scientist when I'm not. Yeah. So the first thing from our side, because we look at unavailable research, and for example, we had Professor Glenda Gray on our side where she did a report on Friday. She did a report that speaks specifically to the research that has been done on the health professionals who were part of the Sisonke program. That research clearly shows the side effects, and you'll see even this morning, we released some of the information about the side effects. Any vaccination, any form of medication you take will have side effects. That's the first thing. So sometimes we tend to want to make vaccines that are related to COVID as if they are special and they must be supernatural or superpower. It doesn't work like that. All vaccines, all medication will have their side effects, they will have their efficacy, and that's why we have to consistently test whether to which level, because we're looking at whether they are sitting at what percentage of efficacy. None of them are 100%. So they are not a cure. They are actually assisting us to prevent for severe illnesses. They are assisting in case a person has COVID-19. They are assisting us to prevent in terms of death. So that's where it is. Because if we take the conversation to that angle, then we might miss the point of why we are rolling out vaccines. So in terms of the study that is, which we've shared publicly, with Sonke in J&J, we do not have severe, where we've got, like the report is out there to show you, in the number of people that we've had, this is what we learned out of that, the treatments and all those things. And that's why we are still comfortable to rolling out J&J, even in rural communities.
Vaccine hesitancy is still very much a problem, Minister, with some within the population of South Africa. What is your message to those people? Because there does seem to be this connection that people are making to say, even if you do receive the jab, in fact, there are those who are of the view that after receiving the jab, that's when they actually get sick, almost to a point of being hospitalized, and some people have suggested that others have died as a result of receiving the vaccine.
Yeah, what we have asked, firstly, in terms of those who say they have family members, relatives, and anyone who has died after taking the vaccine, we've asked them to report it to the healthcare workers or even through our call center, so that can be investigated.
How many of these cases are you seeing, Minister?
No, we actually have asked. We were actually seeing low rate in terms of people who are reporting of cases who have passed away. We had to do a more outreach to request people to report. So you'll see social media reports, but not formal reports. I don't know if you understand.
Yeah.
So in terms of somebody, you see somebody saying this, so you don't know whether it's fake or it's true. So that's why we're encouraging people to register this within our system, so that investigation can happen and we can be able to understand. Secondly, we do have quite a number of people who've shared stories, so it's equal both ways. Yes, we have people who say that I've gone to vaccinate and therefore I've done this. But others who are picking up that when you start interrogating, that's why it's important to investigate. Several of them that I have spoken to, because some family member would call me, I've got a granny who's sick because they've been to vaccination. And then you interact with them. You start realizing that in the process there was no full disclosure of their comorbidities. So that's why we've gone out to start emphasizing the full disclosure when you go to vaccinate with the nurses. Tell them exactly what you've got as a comorbidity or whatever treatment that you are taking. That's the first thing. Second thing is to follow the instructions correctly. Yeah. My mother went to vaccinate for her second jab. She came back. She felt like she's got something like an allergy, and she wanted to take an allergy. I had to stop her to say, no, you can't. Remember, you only have to take Panado. And she's fine. It's more than 7 days now after the vaccine. Right. So it's those things that we've got to consistently remind our elders, especially in the elderly population, to say, once you've taken the vaccine, please make sure that you follow. When you go, ensure that you tell them exactly what you've got. Make sure that you've got when you come back, you know exactly what you should do and what you shouldn't do. But also, many people seem not to know that you can take a vaccine if you are COVID positive. But also, if you've tested positive, you need to wait at least between 30 to 35 days between symptoms and non-symptoms after recovery before you can take the vaccine. So that information, that's what we are picking up, that some of the people seem to have missed it, and we are putting it in the public to be able to assist the communities. We do believe once people have enough information about what this vaccine is about, what they intend to do, and what are the side effects, then people will be able to make their choice. Remember, in the country, we said it's not mandatory for people to take the vaccine. Yeah. We would want people to take the vaccines because they believe they are going to save them. They are going to reduce their rate, the possibility of them ending up in hospital, reduce their possibility of ending up dead if they do get COVID-19. But it's still individual's choice.
Minister, I've got to end the conversation with you, but I can't not do my job as a journalist, which is to ask you about some calls that have been made. At least one political party is on record as saying that the president, health, given the pandemic we are going through, but your responsibilities are split between health and the tourism industry. Have you had any consultations, Minister, with the president thus far? There does seem to be talk that before the end of this week, there might be changes in the executive. Have you had any consultations with the president?
So all of us as ministers regularly in our work, we consult with the president on advice for our work, and that's far I can go. That's what the work I do, consulting around who gets to go where and what is above my pay grade.
I had to take my chances. Thank you very much, Minister, Acting Minister of Health, Mmamoloko Kubayi.